Welcome to this video. Today we will be discussing why brief psychotic disorder, schizophreniform and schizophrenia are divided into separate disorders. In the DSM-5, brief psychotic disorder, schizophreniform disorder, and schizophrenia all fall under the category of schizophrenia spectrum disorders, and at first glance they look nearly identical. They share common symptoms: hallucinations, delusions, disorganized speech, and sometimes disorganized or catatonic behavior. The biggest difference between them is duration. Brief psychotic disorder lasts less than 1 month, schizophreniform disorder lasts 1 to 6 months, and schizophrenia lasts longer than 6 months with functional decline. Because of this, it may seem unnecessary to separate them, and instead simply use one diagnosis with specifiers. However, the DSM intentionally keeps them distinct because the differences in duration reflect clinically meaningful differences in prognosis, causes, treatment planning, and long-term outcomes. Duration is not just a time marker, it often signals how the illness behaves biologically and psychologically. Brief psychotic disorder is usually triggered by extreme stress or trauma and often resolves completely, sometimes never happening again. Many individuals recover fully without long-term impairment. Schizophreniform disorder has a more uncertain outcome. Some people recover fully, while others eventually develop schizophrenia. Keeping it separate helps clinicians monitor patients closely during this transition window. Schizophrenia, by contrast, is a chronic and often lifelong condition involving structural and functional changes in the brain, meaning it requires long-term management and support. Lumping these conditions together would blur these important differences and make it harder to predict treatment response, plan interventions, or provide accurate prognosis to patients and families. Separate diagnoses also help clinicians communicate clearly, conduct research, and avoid mislabeling. For example, diagnosing someone with schizophrenia after only a few weeks of symptoms could cause unnecessary stigma and long-term implications. So even though the symptoms overlap, their course, severity, and expected outcomes justify distinguishing them as separate disorders.